Thank you, Singapore. We're obviously, as a very young company, humbled and honored by receiving this award. As we stand here, we're 3 years, 1 month, and 29 days old, so pretty young, and very proud to receive this. And I think I want to thank three groups of people here as we stand here. Number one, obviously the team that stands behind me. I want to thank Singapore for recognizing and the great team that has awarded us. But thirdly, also our customers. We're now active in 7 countries. We're applying our solutions not only here in Singapore, they have gone across Southeast Asia. And I think it's a testament that with our solution, we're trying to be part of a transformation of healthcare here in Asia, making healthcare accessible, affordable, and effective for us as consumers and obviously patients. Thank you.
Thank you for the question and thank you for honoring us with the award. Let me start with this. I think this is a very interesting and important question because you're asking 2 things, identify and prevent. And let me answer this in those 2 dimensions. I think the identify is an element where obviously we capture the data from the claims and we use state-of-the-art technology, be it natural language processing, to actually extract data and make it readable for our systems. The second step then is really to, based on a clinical encoding technology, make data across hospitals and across procedures comparable. And once you have the data comparable, we are able to do the outlier detection. And based on outlier detection, we can then identify the claims that within a fraud, waste, and abuse system are then fraudulent, wasteful, or abusive. Now, I think the question is then much more important how to prevent. Because, identifying doesn't save an insurer money and it doesn't make the fraud, waste, and abuse go away. So what happens once we have identified this? And I would like to answer this in 2 ways. Number one is, I think, in fraud, waste, and abuse, there is typically a 0-1 category, and that's easy. A 0-1 category basically tells you don't have to pay the line item, the claim in totality, because the patient, the insurer, is just not eligible. That's the easiest case. So it's a 0-1. More importantly, obviously those where you may have judgments to take whether or not you want to pay out the claim. And I think this is where the prevention goes far beyond just the fraud, waste, and abuse technology, and it actually integrates into the entire business operations of a health insurer or a life insurer here in Asia. And I think there are probably 3-4 areas that I would call out that need to obviously be trained and need to be accustomed with these fraud, waste, and abuse outliers. I think the first one is the easiest one, the claims operations process, where typically the assessors need to be trained and skilled up in order to work with these technologies, which is something new. Health insurance is small here in Asia and it obviously needs a skill up of the operational base. I think that's number one. Number 2 is, as you identify claims that are fraudulent or wasteful, you need to integrate this into your provider management negotiations discussion. So to make it transparent, tangible, you obviously need to go to a hospital and say, dear hospital administration, dear professor, what we have been observing as a solution needs to be changed and needs to be addressed through a negotiation. I think the other 2 areas where I would argue the identification needs a further integration into business processes when it comes to the product design, but also the core claim system, because a technology in and of itself that is not integrated into a product, i.e. the proposition to say you're allowed to go to a Dr. A or not allowed to a Dr. B, needs to embed it in health insurance propositions. And I think the last one where I was talking about is core claims systems, where it needs to be embedded into the system of a health/life insurer here in Asia. So this is the way I would answer your question. How do we prevent? Through technology, but then how do we identify, and then how do we prevent based on the learnings from a technology? I would also like to answer this in 2 ways. I think the first one is around business and digital maturity of an organization, and the second one is obviously market characteristics. I think for the first one, if you have an organization that is actually not very mature in its digital transformation or in its health insurance processes, being able to offer a modular, however end-to-end solution that we as Amplify Health do provide, I think we can address all the needs of an insurer, as I often say, in a happy-go-lucky package. Yeah? So you can buy a module for OCR, you can buy a module for core claims, you can buy a module for fraud, waste, and abuse, but you can also buy individual modules like a rule engine and a benefit management. So you can create a package around this modular way, but obviously the benefit of having it modular, if you have an organization that is mature in its digital processes or in its overall health business processes, it is clearly advantageous to be able to have state-of-the-art point solutions that address a particular issue of an insurer that hasn't been solved yet through a respective module that you can then apply. So it goes either modular or in totality. I think the second part of my response to your question would be clearly across the different markets' needs. And I think what is important here is that as we think about the vast majority or the vast differences of all the Southeast Asian markets, I think being able to tune and adapt the individual modules, but also the entire solution to the respective markets' needs is, I think, one of the critical enablers for us to actually serve the needs of the market. And for us, being 3 years old, what we've been able to do now is to serve markets in 7 different countries by adapting all of our solutions to the specifics of the market and tuning and training our models based on the data that is available. I will say that based on the work that we have been doing, what we have created as Amplify Health is a universal data model that allows us now to also make between countries data comparable, and by doing so enhance the capabilities of our clients. It's a very far-reaching question. And what I will say is that obviously the way Gen AI has been shaping the 2025, but even the years before, is progressing so fast that it is obviously very difficult to predict how 26, 27, 28 will look like. What I will say is that our solutions already today are using state-of-the-art technology and Gen AI solutions. And from that point of view, I think whatever we are seeing in the external development, we actually do pick up and embed them into the individual modules that I just talked about immediately. So any kind of acute developments are put into the roadmap of our solutions and are made available to our clients as soon as they have reached maturity when it comes to user acceptance testing or just our release planning, as for every software development company. I think the part that I think is interesting to your question is how will the claims processing actually evolve? And I think through Gen AI and especially AI agents, we will see a significant evolution and speed up of how I think a digital first kind of processing will be applied in most of the insurers here across Asia. So it will be a much more, as I said, digital first processing versus a human labor driven process. And we as Amplify Health are very much at the forefront of building digital first solutions that allow for efficient and effective processing of claims here. I mean, think about it. In Southeast Asia, I have claims of 100,000, 200,000 a month with 10 to 20 pages. So with the entire digitization that is now coming through this, we will be obviously experiencing a very fast, efficient and effective processing of claims through the Gen AI implementation. Well, first of all, as I said at the beginning of the interview, we're obviously honored. Yeah? So what it means for us is that we as Amplify Health, the team that is also present today, want to celebrate us as a young and I think fast-growing company. I mean, to remind also the audience, we were actually founded in March 2022, so we're just about 3 years and a month old, and winning the award at this early stage is obviously a booster for us as team, understanding that we're on the right path, developing our solutions that are being recognized, especially here in the Singapore business community, which I think is obviously, that has a high bar when it comes to that. We will obviously use this award to go beyond Singapore. I think in many aspects, healthcare is not only, in many aspects, I think healthcare in Singapore is seen as a lighthouse for many other Asian markets, like the Southeast Asian markets, be it Vietnam, Thailand, Malaysia, Philippines or Indonesia. So we will take the momentum that we have received through that to bring this to other markets and fulfill, I think, our broader mission and ambition to develop affordable and accessible and effective healthcare here in Asia and be a critical part enabling this through the technology that we as Amplify Health provide.